Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Tests for ovulation. The basis for tests of ovulation: if female ovulates, progesterone is present. If female does not ovulate, then progesterone is absent. The major hormone if the female does not ovulate is estrogen. Time for tests of ovulation. The tests for ovulation are done on 22nd day of cycle if the cycles are regular. If the cycles are irregular, then they are done 1 week before menstruation. So, if the female is ovulating, that is progesterone is present, or if the female isn't ovulating, that is estrogen is predominant, in them the tests will differ. So first, cervical mucus study. In cervical mucus study, if the female is ovulating, that is progesterone is present, furning is absent. If the female is not ovulating, that is estrogen is predominant, then furning is present. Vaginal epithelial study. So for vaginal epithelial study, for hormonal studies, the sample is taken from the lateral fornicle, that too in the upper one third of the vagina. When you take the sample for vaginal epithelial study in the upper one third of vagina, then you will see intermediate cells if the female is ovulating, that is if progesterone is present, and if the female isn't ovulating, on taking the sample from the lateral upper one third of vagina for hormonal study, you will see pink colored cells with pycnotic nuclei, and superficial cells are also seen. Basal body temperature. Basal body temperature, if the female is ovulating, that is if progesterone is predominant, temperature increases by 0.2 to 0.5 degrees Celsius or 0.4 to 0.8 degrees Celsius in the mid cycle. If the female is not ovulating, that is estrogen is predominant, then basal body temperature remains constant. Then endometrial biopsy. Endometrial biopsy, earlier endometrial biopsy is the best test, but now endometrial biopsy is not the best test as it is invasive. If the female is ovulating, then it results in corkscrew appearance or sawtooth appearance of the glands filled with secretions. If the female is not ovulating, that is if it is estrogen predominance, then you will see simple cystic tubular glands are seen. Indications of endometrial biopsy. In a case with infertility, endometrial biopsy is indicated if you suspect genital tuberculosis or luteinizing phase defect diagnosis. Important stages of endometrial biopsy. On endometrial biopsy, the first sign of ovulation is subnuclear vacuoles will appear. Maximal stromal edema is seen on day 22 of the cycle. Leukocyte infiltration is seen on day 26.
thank you and thank you for watching.